My name is Bill Wiese with Harris Silver. We're co-coordinators of the Bernalillo County Opioid Accountability Initiative, and we co-chair the coordinating committee that planned this conference. So I'd like to get going right away and introduce Commissioner Maggie Hart Stebbins to give her welcome. We're all here because of her initiative beginning several years ago. Briefly, many of you know her. She's been a Bernalillo County Commissioner since 2009. She has a career-long commitment to public service and champion of many areas, including behavioral health, substance abuse, and passion and understanding for the importance of bringing together community as the essential step in getting things done. Commissioner Stebbins, Hart Stebbins. I don't know, I think this goes in here and doesn't do well by itself. Oh, yeah. Okay.
Morning, everyone. And thank you all for being here. I am really delighted to be here to welcome everyone to Bernalillo County's second Summit on Opiate Addiction. It's great to have all of you amazing, committed, knowledgeable people here, ready and willing to share your expertise and give your time to help change the course of opiate addiction and death in New Mexico. I want to start by recognizing everyone in this room is really absolutely vital to this effort, but I want to recognize a few VIPs who have taken their time to be with us today. And I'm not going to go in any kind of priority order, so please don't be offended that I haven't followed appropriate protocol. I want to start by first introducing Gordon Eden, our Albuquerque Police Department Chief. Greg Farrat, our Secretary of the New Mexico Department of Public Safety. Our new Sheriff, Manny Gonzalez, our new Bernalillo County Sheriff. And our U.S. Attorney, Damon Martinez. University of New Mexico Health Sciences Center Chancellor Paul Roth. Jerome Sanchez, the captain from the Santa Fe Police Department. Excellent, thank you. And my colleague on the Bernalillo County Commissioner, Lonnie Talbert. Really glad to have you here, Lonnie. We have the Chief of Police of the Isleta Pueblo Police Department, Kevin Mariano. David Martinez, the Deputy Chief of Police of New Mexico State Police. Carrie McKinstry, EMS Captain from the Albuquerque Albuquerque Fire Department. And we have our newest State Senator, Mimi Stewart, who's here. Thank you for being here. And I apologize if there's anyone else that I have left off this list, but I just want to let you know how grateful we all are that you are here today. So I'd like to give you just a brief history of how we got to this event today. What you see here is a result of more than 4 years of dedicated work by our Bernalillo County staff, the Bernalillo County Community Health Council, and literally hundreds of people across the state of New Mexico who have joined with us to address this multifaceted, complex issue of substance abuse. This summit really started with a meeting I had with Jennifer Wiese, the founder of Healing Addiction in our community. Several years ago, in 2010, Jennifer came to a meeting of the Community Schools Partnership Board and talked about the growing epidemic of heroin abuse among New Mexico's youth, the devastation that addiction visits on families, individuals, and our community as a whole, and her frustration with the lack of attention that elected officials were giving to this issue. The more I learned, the more horrified I was by the breadth and depth of this problem. The numbers of addictions and deaths, the brazenness of drug dealers, the easy access kids and adults seem to have to heroin, the lack of resources for families who are struggling with addiction, and the burden on our court system and our healthcare system, and the rippling effects of opiate abuse across this state. And that raised the question, what could Bernalillo County do? What is our role in solving this problem? So to answer that question, I turn to the experts. Because opiate abuse has so many facets, any potential solution must include the engagement and participation of healthcare providers, law enforcement, corrections, schools, parents, judges, jailers, pharmacists, federal, state, and local governments, organizations that do prevention, and those who work with families in the grip of addiction. So in 2010, I met with Marcia McMurray-Avila, the director of the Bernalillo County Community Health Council, and asked if she and the council would be willing to identify and bring together all the relevant individuals and organizations who in one way or another were engaged in addressing this problem. I asked Marcia if it was possible to get everyone together to develop concrete recommendations for what changes need to occur, what policy, programmatic, and funding decisions must be made to turn the curve on opiate abuse in the state. And Marcia said yes, and she took it on. That first summit took 2 years to plan. It's a very thoughtful, exhaustive process to identify all the individuals and organizations that needed to be at the table, to identify the goals and deliverables, and to develop the framework through which this work would be done. Marcia put together a 30-person planning committee, and again, engaged literally hundreds of people across New Mexico. And she initiated a focused event, a focused effort to foster collaboration among the many partners who could play a part. We hosted the first summit in the fall of 2013, and many of you were there. The work has continued through working groups established at that first summit, and we're here today to hear back from those working groups, regroup, and establish the path forward. This year, our efforts have been greatly enhanced and strengthened by 2 fabulous new partners. In the leadership of this work, our U.S. Attorney, Damon Martinez, and Health Sciences Center Chancellor, Dr. Paul Roth. We are thrilled that they now bring their personal commitment and expertise and that of their organizations to this collaboration. From the start, Bernalillo County made a commitment that this would be a meaningful, sustained effort, not a one-shot token press event, but a serious, sustained, long-term collaborative effort to address one of the most insidious and urgent problems in our community. And as an elected official, a key end goal for me is to identify the concrete legislative and administrative actions that our local governments need to take to address the many aspects of opiate abuse. We are not the experts, you are. And we need your input and guidance to help us do our part. And you can provide the advocacy to get your ideas approved when they come before a vote. I want to thank all of you. Those of you who have been with us from the beginning, and those of you who are here for the first time. This effort will be successful because of your commitment, your dedication, and your generous investment of your time and expertise, and I am deeply grateful for that. I want to particularly thank our coordinators, Bill Wiese and Harris Silver,
I got to talk to that person
who have done
today.
an absolutely heroic job.
That's what the break times are for.
Dedicating countless
It's to allow
hours
networking.
to this effort.
Ultimately,
on top of
our
all the other
structure
great work you do in this
is
community.
that
Thank you.
we are not
And
the initiative is.
And of course, I need to thank Bernalillo County Health Council Director, well, the Health Council and Director Marcia McMurray-Avila, who has worked tirelessly on this. So anyway, thank you all for being here. We've got a lot of work to do, so let's get to it. Thank you.
Good morning, everyone. So I'm Harris Silver. I'm a retired physician. I work currently as a drug policy analyst and advocate. And as Bill said, I'm one of the co-chairs of the initiative. And it's great to be here. I'm just really amazed at the incredible collection of people we have from almost every sector of the community related to substance use disorders. As you know, this is a horrific disease, and it's a community problem that will take a broad community effort to bring this scourge on our community to become a manageable problem. And that's why we need all of you here, and I'm very happy to have you here. What I'm going to show this morning is some basic data. And the data does tell a story, and I'm going to try to narrate that story as I go along. The data is data I received from the Department of Health, and I need to thank and acknowledge Luigi Garcia Saavedra. Luigi, are you here? There he is. Thanks, Luigi, for the data. Department of Health. And Jim Davis, who's not here. Okay, so this is the keynote variable, is overdoses. That was the goal of our initiative, was to get the overdose rate down. So you can see the upper line is Bernalillo County, the lower line is the state, and in the last 2 years, we've had a decrease in the overdose rate of 26%. And I want you to pay attention to the last 2 years, beginning in 2011 to 2013. For the first time in 2013, the county rate has actually converged with the state rate. We've been well above. For many years, we've been in the second tier of county rates for high overdoses. Rio Arriba County was basically in its own tier. And then along Bernalillo County was in a second tier with a bunch of other counties. So I'm going to go through the slides here, and maybe we can tease out why that rate's gone down, and it's gone down 16% in the state, and I think there's several reasons for that. Next slide, please. So let's look at the overdose rate by type for Bernalillo County. So you add all those overdose rates on the bottom 3 lines together, and you get the top line, which is the total for Bernalillo County, which peaked around 2008. So the orange line, if you look for the last 2 years, from 2011 to 2013, it looks just like the blue line. And it appears to be where we're getting most of our drop in the overdose rate. It doesn't seem to be happening from illicit drugs or from when there's mixed illicit and prescription drugs. So one of my theories is we do have a significant surge in heroin. We've had what I believe is a drop in the prescription overdose rate and also prescription drug use. I can't prove that to you, but I think that's part of what's happening here. And because it's a national trend where people are going from prescription opioids as we put controls on to try to reduce overprescribing and diversion, and people are going to heroin because it's a lot cheaper. On the street, you buy oxycodone and hydrocodone for $1 a milligram, and heroin's about 1/4 of that price, and it's very pure these days. So, so some evidence that heroin is a significant issue is if you look at the rates of neonatal syndrome, the bottom orange line is in the US, the blue line is for the state, and if you look at the upper line, that's actually the rate here in Bernalillo County for neonatal abstinence syndrome, which is primarily an issue with heroin. And it's going up, and it's going up at a significant rate through 2013. This looks like, and actually one of the best slides I'm going to show you. So the rate of the prescription of buprenorphine with naloxone, otherwise known as Suboxone, is going up rather rapidly too in Bernalillo County. In fact, it's more than doubled between 2009 and 2013. Yet, it takes just as long to get into providers. It takes about 3 to 4 weeks to get into a provider right now. So I think we have a greater and greater demand for this drug that's going over the past few years. We look at total drug poisoning in the emergency department, related visits by sex, and it doesn't matter. We have about the same rate throughout the state, male and female. Look at opioid poisoning, emergency department related visits, and you see males have the highest rate. It's also staying pretty much the same, so it's not, this doesn't give me a lot of information. And the next one is heroin poisoning, also staying about the same. Now we're looking at total drug poisoning for hospital inpatient discharges, and this will be for all overdoses. And that top line, if you look at let me go to the last one again. And the top line was males for emergency department. They lead by far. The second line there is males for New Mexico. The third line down I'm sorry, the second line down, yeah, the third line down is females for Bernalillo County. So we go to hospital admissions, and it's a little different. For New Mexico, the leader is actually females. And the second line, the orange line, is males. And when you come down to 2012 and 2013, we're about the same in Bernalillo County as the state. But I think for a while there, the reason females were higher is because there's a higher admission rate because of pregnant females tend to get admitted more. It's a little hard to interpret some of this data. So then we have opioid poisoning again, no major change in the trend, and also by males or females. And heroin hospital inpatient, maybe going up a little bit. So here's where we're getting some really good information. So we have the Youth Risk and Resiliency Survey taken every 2 years by 8th through 12th graders. And if you look on here, we have the rate of Bernalillo County and New Mexico students who used the painkiller to get high during the last 30 days. And the rate has dropped dramatically, both in the state and Bernalillo County, since 2009. It's dropped by about 1/3. So, but here's the bad news. Here's current heroin use. That top line is Bernalillo County. We are just about the leader in the state, except for one other county. So 1 out of 20 students in 9th to 12th grade have used heroin in the last 30 days in Bernalillo County. 1 out of 20. It's a little better for the state, which is the line below that. So I'm trying to put some of this together and why we're seeing these trends. And this slide, I apologize because it's a little bit busy. So the lines are the enrollees for people in harm reduction services. And it's basically people that are getting Narcan is what it represents for us, or the naloxone, the drug that reverses opioid overdoses. And you can see the number of enrollees is pretty high. It peaked around 2012. We're pretty close to that in 2014 for the state. And we're not sure, but the number of enrollees in Bernalillo County is definitely going down. And then the bars on the bottom of the graph are reversals with naloxone, which are something that I think the state should be very proud of as you see it growing. So in the orange, we had 80 documented reversals. So how do we know they're documented? People come back to get some more Narcan, and they fill out a form, and they say, why do they need more Narcan? And they actually talk about if it was used in an overdose, and if the overdose was reversed or not. So if you look at 2010, we had 80 reversals in Bernalillo County and 205 in the state. Go to 2014, and we haven't had a huge jump in Bernalillo County, up to 119. But look at the state, 770 drug reversals. So that's huge. In 2013, we had 440 overdose deaths, 770 overdose reversals for the whole state, and 440 overdose deaths. and most of those reversals are in heroin users. So why is the heroin rate not going up substantially in our state? And why is the overdose rate going down? I think personally it has a lot to do with Narcan. And there's other factors. The prescription monitoring program is doing a good job. That's contributing to it. Education of providers, education of the community, and prevention efforts. Everything is contributing, but I think Narcan is a big contributor. How about in Bernalillo County? So if Narcan is not nearly as big a player, because we have about 1/3 of the population, yet we don't have 1/3 of the documented reversals here, what is it? And I think one of the big players here is Suboxone is saving lives, because there's no place that Suboxone is more readily available and dispensed in a higher per capita rate than in Bernalillo County. Again, this is data from the Department of Health and both the Public Health Division and the Epidemiology and Response Division. So harm reduction means the harm from getting Narcan from the Department of Health offices. And then we have what are called co-prescription pilots, which has been run also by the Department of Health with certain medical providers, where they are co-prescribing Narcan to people who are at higher risk for overdose from prescription opioids. So these are why they're called co-prescription pilots. And we had none in Bernalillo County. We had actually none prescribed in 2013, but we had 82 prescribed in New Mexico. In parentheses is the number of doses, and it should be at least double, because everybody gets 2 doses of Narcan. And you see harm reduction in New Mexico. There are 1,048 enrollees were involved, and there were 3,620 doses. So some people are getting extra doses after they're using the Narcan. In 2014, you see an increase. We actually have a co-prescription pilot going here in Bernalillo County at the UNM Pain Center, and good for them. They've gotten out. I think the number's higher, but they've prescribed Narcan with prescription opioids to 86 people. And throughout the state, it's been 249 people. And again, here's the saves in 2013 and 2014. I showed you that before, 709 in 2013, 770 in 2014. The last thing I want to go through for you here is the total overdose rate by small areas. And that's Bernalillo County, obviously. And small areas are made up of census tracts. They're actually configured by the Department of Health. Each one averages a little over 20,000 people. And there's 3 colors there: light blue, medium blue, and dark blue. And light blue are the small areas which the average overdose rate between 2008 and 2011 was below the state average. The darker blue are middle overdose rates, and there's about 7 small areas that have the highest rates. There's a little bit of a blow up there. I'm not sure what the red dots are. We'll have to get with Luigi afterwards. But you can see, I'm not going to point because I can't do both screens at once. So you can see the Rio Grande River coming down there, and you can see I-25 and I-40. And I'm going to go to the next screen because it shows you the streets in blow up downtown there. But you can see where our worst areas are. And I'm going to give you one more picture and tell you what those worst areas are. So if you look at Area 1, a lot of people call that the International District. Area 2 is Central and Wantabo. Area 6 is down next to the airport and base is Gibson and University. And you'll notice the area just above that is UNM, very low overdose rate. It's the UNM area. Area number 8 next to number 5, which is UNM, which is Lomas and Broadway. That's the highest rate. That's the highest rate in the state, actually. but we think they attribute it to, we attribute a lot of overdoses that are homeless end up going into that small area. I'll go through a couple more of these. Area number 14 on the lower left is Arenal and Tapia. And then areas 19 and 20, surprisingly, around Candelaria and 2nd and Comanche and Carlisle. And the last thing, I want to switch gears just for a minute. It's my last slide. And these are kind of what you're going to be hearing about today, some of the barriers and obstacles, and I'd rather call them challenges that you're going to be hearing about in our various talks that we're faced with. And this isn't just Bernalillo County, but some of them are specific to Bernalillo County, like the huge size of the county. But identifying and getting to know key stakeholders has been a challenge. Lack of access to key stakeholders and leaders is sometimes a challenge. Lack of a sense of overall community in Bernalillo County because we're so big. So we have many communities that function autonomously, which makes it harder to do this job. A non-alignment of priorities among stakeholders and leaders. A lack of resources. How about this one, stigma and difference? Anybody think that one's a big one? Okay, good. Lack of political will, and our needs are low on the priority list. Not enough volunteers relative to the amount of work. We have a huge amount of work to do, and difficult to get Metropolitan Detention Center inmates signed up for Medicaid. And with that, I'm wrapping it up. Thank you. You're a great audience.